Today, treatment options for patients with multiple myeloma who are ineligible for transplant. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Patients with multiple myeloma who are transplant ineligible can receive therapies delivered through an IV or subcutaneous administration. Our guest today walks us through what the cancer team needs to consider about the different therapies. Dr. Cindy Varga is a hematologist at the Atrium Health Levine Cancer Institute in Charlotte, North Carolina. Tell me about the benefits of a subcutaneous drug administration.
Yeah, certainly. So there are benefits to the patient as well as benefits to the institution that provides it. I can tell you for the patients, it is a very fast way of delivering medication. With some of the IV formulations, patients would have to sit for an infusion, especially with the first dose, up to like 7 hours. And with a subcutaneous injection, it's as quick as 5 minutes. And so for the patient, there's convenience there. There's also less infusion-related reactions when we're talking about a monoclonal antibody that's being delivered. And so they get less side effects. And for the institution, it saves on chair time. So we can have more and more patients coming into the infusion center because we have more spots as patients come in and out.
Are there drawbacks to subcutaneous administration?
So the downsides are actually few to none. One of the downsides that I've seen with my patients is they can get these local reactions, skin reactions that can irritate the patient. And so sometimes we have to keep changing the location of the injection. And to me, that seems to be really the only complaint that I've been getting from patients is just these local, skin reactions. Otherwise, I haven't seen much of a downside to the subcutaneous formulation.
Why might a patient choose intravenous administration?
So for intravenous, they don't get stabbed in the stomach. So they save themselves, some skin reactions that might occur. If a patient has a port, really it's not such an inconvenience because especially if they're getting other, IV infusions with, other drugs that are in combination with this monoclonal antibody, then it's not so much of a big issue. If they're coming in for that IV medication anyway, they can get IV, monoclonal antibody as well. But it does involve a little bit more time in the chair with the IV formulation. And, we talked a little bit about infusion reactions. I did mention with the subcutaneous formulations, they tend to be less important. But even for the IV formulation with subsequent doses after the first dose, those infusion reactions also tend to resolve completely too. So I've had patients, ask to switch from injection to IV because it's not really an inconvenience for them. And those infusion-related reactions do resolve over time.
How does this impact patients?
So having patients be able to access these amazing drugs, in their local infusion centers definitely helps with, their upfront treatment plan. These patients are going into remissions. These patients are feeling better on these drugs. Their quality of life is better on these drugs because they're so effective with such little toxicity as well. So I think it really is changing the way we treat multiple myeloma while we introduce these immunotherapies up front.
Thank you, Dr. Varga, for joining us today. You can take a look at the show notes for resources on multiple myeloma treatment options. Until next time, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.